Great. Okay, next slide. All right, no conflicts of interest, so next slide. The learning objectives are here. I think you guys can probably all read them, and you were emailed the PowerPoint, I think, so you probably have them. Okay, next slide. All right, so I'm going to be talking today about the new CDC guidelines that came out for healthcare testing. And the first thing I just want to make clear is that healthcare personnel TB testing rules and requirements, they really do vary by state. These rules are very state specific. So you want to really make sure that you check in with your state TB program. And I think you all know this, but the first time I presented this, it was for a more general audience. Also, just so everybody is aware, OSHA and then state healthcare facility licensing agencies may also have applicable rules or rule interpretation. So for example, in Oregon, like my program does not control all the rules related to TB testing. And sometimes they're changed and I don't even know it because another program will change them. So for example, here in Oregon, we have an outpatient opioid treatment requirement, and that one is regulated by Addictions and Mental Health Division, and I have no control over that rule. They write it. Okay, next slide. So the Oregon administrative rules anyways are based on the CDC and MWR 2005 guideline and also the new guidelines. So we've already implemented it here in Oregon. Okay, next slide. So just a little bit about what the changes are with the new 2019 guideline. You still need to do the baseline testing upon hire with the two-step TB skin test or a single IGRA, that's either the T-spot or QuantiFERON, and an annual facility risk assessment still needs to be done at every healthcare facility. However, the big deal with the new 2019 guideline is that if the facility is low risk, they don't need to do annual testing, and that was true before. Now, if the facility is medium risk, they don't need to do any annual testing at all. So that whole bit has basically been taken away with the new 2019 guideline. Okay, next slide. So just some other things to be aware of that are in the 2005 CDC guideline, and you should take a look at that if you get a chance. It is over 100 pages, so I fully realize not everybody is able to read that. It's huge. But there is a lot of information in there that's good, like about how to manage patients with TB, for example, patients who are on a vent. It has some instruction about how to do that. It has suggestions for the annual required training of healthcare workers. So that's a good piece. It also has quite a bit about the required respiratory protection program, including the PPE that should be worn. And I always remind people here that OSHA has a mandate now that annual fit testing is required for N95 masks. I still find, at least in Oregon, that not everybody yet has gotten that message. So just so you know. All right, next slide, please. So new as of May 2019 is this new CDC guideline. And luckily, it's only 5 pages. So I think everybody will be able to get through those 5 pages. All right, next slide. So why were these guidelines changed? And this is a little quote from Dr. Belknap over in Denver Metro. Basically, the continued routine practice of annual TB testing has been costly, and as you all know, it results in false positive tests, and it's just not any longer supported by what we observe in the healthcare setting over time. So this movement away from annual testing is really long overdue, and I completely concur with that, and that's why we pushed through the new guideline pretty quickly here in Oregon. Okay, next slide. So like I mentioned, the biggest guideline change is there's no annual TB testing required any longer for healthcare personnel, unless there's a known exposure or ongoing transmission. So the guideline, oops, not ready yet. So the guideline does say, the new guideline does say, consider serial testing for groups with increased risk for exposure in areas where transmission has occurred in the past. So in Oregon, we decided that we don't recommend serial testing in most settings. This may be different in Washington and other states, but in Oregon, no, we're a little bit lower incidence than Washington. We also say, The light keeps going off. We encourage the guideline says to encourage healthcare personnel to discuss any possible occupational or non-occupational TB exposure with their primary care provider in occupational health. So then the decision to test us should be based upon that person's TB exposure since their last test, basically. So we say here in Oregon that that would be voluntary and just part of the annual employee education. So, you know, you would basically, during your annual employee education, remind people that if they were traveling or doing something like that, that they should be tested for TB. But as occupational health, you wouldn't really be required to document that. Okay, next slide, please. So another change in the new guideline is now LTBI treatment is strongly encouraged, and this is a really good change. So any HCP with a positive TST or IGRA should have symptom evaluation and chest x-ray. And then, you know, with a confirmatory test if the healthcare provider is low risk. And you guys probably all know that the IGRAs and TB skin tests can be falsely positive. So if there's low risk for exposure, you'd want to retest them if positive on the baseline. And then, assuming the person does have LTBI, treatment is strongly recommended. And the shorter course LTBI treatment regimens are what is encouraged. All right, next slide, please. So another change in the guideline is now there should be annual symptom screening for HCPs with untreated LTBI. So the guideline says if the HCP has untreated LTBI, you want to screen them annually for TB symptoms. And then when you're screening them, you want to encourage LTBI treatment again. And then also remind the HCP to report if they develop symptoms of TB. Now, I found, at least in Oregon, since we've already implemented this is kind of a tricky point for healthcare facilities to implement. There's a lot of places this can fall apart, you know, depending on how strictly you take this. It might require occupational health to follow up with each employee who tested positive and ensure they got treatment. So we're still trying to figure out how best to implement this here. Right now, we're telling a lot of facilities that they could just screen all of their employees for symptoms and kind of leave it at that if they just don't have the capacity to do all that tracking. Okay, next slide, please. So another guideline change is about the annual TB education. It does say that you should educate all HCPs annually about TB. And you want to include information about TB risk factors, symptoms of TB disease, and your TB infection control policies and procedures. And again, you want to use that education as an opportunity to discuss with the HCP any potential occupational or non-occupational TB exposures with their primary care provider or occupational health. So again, you know, any travel history in the past year or anything like that. You just want to remind the providers about that and encourage them to get tested if that did occur. All right, next slide, please. So I'm not going to read all of this, but this is just a little bit of information about what should be in your annual TB education. You know, basically we say here any format is acceptable, and I really recommend that places try to make it site specific so, you know, it resonates with the employee and they actually know what to do if they have a TB case. Also, the CDC 2005 guideline has a big list of potential topics that you might want to look at. This is just what I would recommend at minimum. They're listed below. Okay, next slide, please. So the rest of the CDC guideline is pretty much the same. And at least in Oregon, all of the 2005 guideline is still in effect. So that means that new hire baseline healthcare personnel testing is still required. And this is something I get a lot of questions about, but you still do need to do it. And it still needs to be either a two-step TST or a single IGRA with some nuances, as you probably know. And then you should include with that a baseline individual risk assessment and a symptom screening. And this was already recommended in Oregon. And then, of course, if you have a TB exposure, you need to do a contact investigation. And you need to have your infection control policies and procedures in place. And my interpretation is that you would still need to do an annual facility risk assessment. So that's that little form that you need to fill out every year. I know CDC might come out with some additional guidance for that, but it's really a pretty quick form, and we still recommend here that providers or that healthcare facilities complete it. All right, next slide, please. So when you combine the two screening guidelines, this is kind of what you end up with. Who is a HCP is defined really broadly as in the 2005 CDC guideline, and that doesn't change. I get a lot of questions about this, like does it mean volunteers? Does it mean this kind of person, that kind of person? At least in Oregon, I always say that anybody who has patient contact would be included because the 2005 CDC definition is so broad. So anybody new to your facility would need a baseline two-step TST or a single IDRA. And when you're doing this, you want to include in the screening the TB risk assessment form and a symptom screening. Now, if at baseline there's a new positive test, you would, if there's no TB risk factors, you might want to retest them. That's kind of an individual decision. If indeed they do have most likely LTBI, you'll get a chest x-ray and then either treat them for LTBI in your occupational health service or refer them for treatment. And you definitely want to recommend the shorter course regimens. If the person is previously positive and no history of LTBI treatment, we recommend here in Oregon that you screen the healthcare personnel annually for signs and symptoms of TB and always encourage LTBI treatment. And then you need to educate your HCPs annually about TB and encourage testing, if possible, TB exposure outside of the workplace. And of course, do a contact investigation if you have an exposure. And then, like I said, complete the annual facility risk assessment form. Okay, next slide. So a little bit about risk assessments. I gotta say it's kind of confusing because they use risk assessment to refer to different things. So just a reminder, you have the individual risk assessment and symptom evaluation at baseline, and that refers to the questions you ask the HCP at hire. And you only really need to ask this risk assessment questionnaire at hire. The symptom evaluation is required annually for HCPs with untreated LTBI. And again, you need to educate all employees annually about the need to get tested if there's a new exposure. And then another use of the term risk assessment is the facility risk assessment. So all facilities are required to do an annual facility risk assessment. This part is really not new at all. It's pretty fast and pretty easy. I put a link to the CDC form right there. And then in Oregon, you would also need to access our community EPI profile and the CDC national TB rates to do that. And this was the form that was used to determine facility risk level, but that's not needed anymore because we're not doing annual healthcare testing anymore. So you can just ignore that part. All right, next slide. So right now, I would say everybody's in a state of transition on this. In Oregon, we are probably about 60% of the way there. We still need to come up with some FAQs and do a lot of other work, but we're definitely on the road. All right, next slide. So because we're all transitioning, I think it's important to realize that some areas of the new CDC guideline are definitely ambiguous, such as how to implement the sign and symptom screening of untreated LTBI, and then the annual facility risk assessment piece is still somewhat ambiguous. There should be a national companion document coming out very soon. And I think that might help clarify some of these things, but it's important to know that not all state TB programs are going to agree with all of the elements. I've seen the companion document, it's pretty good, but maybe not all TB programs are going to agree with it. So due to the ambiguity, I still say, even in Oregon, that I might not have specific answers for all things because we're still kind of figuring it out. And in the end, some aspects are really going to be at the facility's discretion. All right, next slide. So I think an important thing is to remember is that a lot of healthcare facilities are not going to be affected significantly by the new guidance, since many were already low risk and had stopped annual healthcare worker testing. Next slide. Okay, next slide. So these are just some of the FAQs I've gotten in Oregon. So annual signs and symptom screening for HCPs who refuse LTBI treatment. How are we supposed to implement that? So again, you need to screen for signs and symptoms only. Documentation of risk factor screening or info about immune status is not needed annually for any of your HCPs. just on baseline testing. So at least in Oregon, I say that this new requirement applies to HCPs hired only after the new guideline was put in place. So I totally recognize that not all of the facilities would have had systems to track whether or not an HCP took LTBI treatment. So we just say it would apply to new staff hired after the new guidelines was in place. We also say that you might consider retesting HCPs if the prior positive test was a TST or the result is otherwise questionable. That is up to the facility though. And then definitely don't stigmatize anybody. Do include education about LTBI treatment benefits when you do the signs and symptoms review, but try not to stigmatize any of the workers. Okay, next slide, please. So again, some ideas about how to implement this new thing. Be creative and do what works for your facility, and you can determine how to best accomplish this signs and symptoms screening. So some of our facilities, what they are doing is like an annual email to the employee, an annual letter, or a telephone assessment. And then, as I mentioned, some are just incorporating it into their overall annual HCP TB training. So they're screening everybody for signs and symptoms of TB and educating everybody about the importance of LTBI treatment and not tracking specific individuals. Okay, next slide. All right, another FAQ. How do we know if somebody has traveled since baseline test? How can we make sure they're tested? What if they become immunocompromised after the baseline test? At least here in Oregon, we say that you are only encouraging the HCP who traveled to have a discussion with either you or their PCP about the fact that they traveled or had other exposure. The facility is not really required to track this info, it's just voluntary testing. Okay, next slide. All right, so that is my short summary. And I can certainly take any questions you might have and try to answer them the best of my ability.